Welcome to the State of Our Faith. This is Faith Commons 1212 Conversations on Sundays during the coronavirus crisis. It is a pleasure to join with you again, and thank you for tuning in, all of you who have. I'm George Mason, and I'm joined, as usual, by Rabbi Nancy Kasten and Imam Omar Suleiman. We're delighted to be together and to have this conversation, but today is a special treat, because the county judge, Clay Jenkins, who is in charge of public health and emergencies here in Dallas County, is joining us today as well. Clay, happy Easter to you, and welcome to Faith Commons State of Our Faith.
Happy Easter, happy end of Passover, and good to see three great friends.
Terrific. Well, we're so grateful to have you, and I know this is a special family time as well as a spiritual time for you. But you have been such a lion for us all during this period of time. And it takes me back a little, Clay, as you can just imagine, because we've sort of been here before. That is to say, in 2014, I remember very well that Ebola crisis, and we were shoulder to shoulder during that period of time. And I'll never forget, Clay, the combination of your commitment to faith and science during that time too. The day you came into my study at the church with an open Bible in hand and said, let's go see Louise Tro and her boys, because we have to tell them this morning that Eric Duncan has died. And I remember you pointing to a passage in the Gospel of John and saying, what do you think of this? I think this would be the place we should read to her from. And we did that day. And I'll never forget the sort of beautiful combination of your faith and your public responsibility. So I thank you for that then, and I thank you for it in these days as well, as you're a real model for us, which is what this program is about too.
Well, thank you, George. And that was a tremendous partnership we had on Ebola. And I think the faith community has really stepped up in this as well, in keeping the community calm. And what we're seeing is, it's the beginnings, it's early, but it looks like we're faring better than the other 10 metro areas, biggest metro areas. And I think it's because of the, compliance with these orders. I hate to say orders, but, that's what they are, I guess. But, the compliance with that, which really, leaders can set the table, elected leaders can set the table for, following science, reason, compassion, or they can incite fear and violence, or they can whatever. But it's really the community that responds, and the community listens to its faith leaders. And so I think each of you are first responders, and you played a huge role in this. So I thank you for that. You've also all three been spiritual counselors to me during a difficult time again. So I appreciate that as well.
Well, at this time, we now, as of this morning, I read we have 1,644 infections recorded in Dallas, and we've had 27 deaths. So it's a sad time of grief and loss for many. Nancy, you have some questions for the judge as well at this time.
Yes, so Judge, there was a great article in the Dallas Morning News this morning, which linked your personal faith to your actions in a very compelling way. And, as you mentioned, we are here on Easter, which is a holy day that epitomizes the messianic hope and faith of Christians. And we're in the middle of the Jewish holiday of Passover, which links that messianic future to the personal acts that we perform as individuals, as citizens, not just as people who go to our synagogues and mosques and churches, but people who live out our faith every day in the public square. And those personal acts that we enact out of a radical compassion for all those who are oppressed at this time of Passover also is linked to that messianic future. So Maybe you could expand a little bit and tell us how your policies and actions with regard to the coronavirus reflect your beliefs about the role faith should play in public life.
Well, so first, I made peace early on in this that it was not my job to try to figure out what the science was or what we should do, or balance between science and financial interest of people. Rather, it was my job to listen to the public health experts and act on that in the most compassionate way possible. And so I heard the science, but then I applied my faith to that so that we could have as little disruption and as little pain. And granted, there is a whole lot. There are people without work, and there are people that are hungry. And, you know, I know all of our hearts go out to that. We're working hard to fix that too. You know, I think probably the first piece of faith is being able to, you know, pray and find peace and act decisively. If you act in faith and not in fear, then even though it's an uncertain situation, you can act decisively. If you move away from that, or at least I find this, and by the way, I respect people of no faith. I respect all people, and I serve all people in this job. But I find that when I try to focus on the temporal chaos that's going on, it's very hard to be decisive when what people need is, you know, decisiveness and implementation of things that will keep them safe. So, and then in everything that we do, just like we did in Ebola, you know, George was a great example, and so were you, and so was the Imam in both these. You know, we treat other people the way we want to be treated, right? We follow that greatest commandment, and we do it as best we can as servant leaders. And so I think hopefully in my best days, that's what I'm doing. And on my worst days, perhaps I'm, you know, angry with someone, but everything that I'm doing is geared towards getting you the pieces that you need to stay safe. And you know, that's the people that I'm making angry. I'm also apologizing to, but I'm trying to move this as quickly as I can.
Well, we're not proposing you for sainthood just yet, but you can be human, and you know, we can still admire your work, and we appreciate it very much. So one thing, to use some religious language a bit about all of this, there is a sense in this being an apocalyptic time, not so much as end of days, but as that more literal sense of revealing what has been true all along. And Omar, I think you want to address this matter of what we're learning during this crisis about the ongoing, long-standing inequities in our society that are really being revealed. What are some of your thoughts, and how would you ask the judge to comment on it?
Right. Well, you know, first and foremost, Clay, we want to thank you again. I've always found you to be, you mentioned us being a source of peace to you in these times, and spiritual counsel to you. I have to say that as a spiritual leader, to be able to reach out to someone in your position and to always have a response within an hour or two of a tragedy is very refreshing as well. So I appreciate that from you and your longstanding commitment to us. With that being said, I think, you know, to speak to what George just brought up, this is particularly interesting to me as a Katrina survivor. In New Orleans, we were shouting about so many inequities that existed pre-Katrina that were then unmasked and you know, unveiled when Katrina hit, and then those inequities only got worse after the national media had sort of moved on. In this situation, you've got a national crisis, and Dallas has, you know, unfortunately, much to reckon with in terms of racialized poverty, in terms of the unlivable wages that the whole country is suffering from, but we've got long-standing inequities that we've been trying to deal with. And in 2016, the Dallas County released a community health needs assessment, and the goal was to create a safe, healthy, equitable Dallas. what needs were identified at that time that make it harder to address the coronavirus? And particularly, I think with faith communities, we're always looking for a way to serve. Our congregants are not just looking for how to worship, they're looking how to worship in service by serving the broader community. So what can the faith community do to address those longstanding inequities that are now making it harder to address the coronavirus in the county of Dallas?
Sure. So take the first part first. What did the community health needs assessment reveal? What it reveals is where there is no coverage, where there is no health coverage, there is no primary care doctor. And today's high blood pressure becomes tomorrow's heart attack. Today's high blood sugar becomes tomorrow's diabetes. You go into neighborhoods where the highest uninsured populations are. They also happen to be healthcare deserts because they don't have the same amenities for healthcare as other neighborhoods. And they're food deserts, and they're park deserts, and they're trail deserts. And so this lack of amenities, not only healthcare, but lack of other amenities leads to poor health outcomes. Now, and I think before we get to what the faith community can do, I think what may come of this, and I'm a Democrat in Texas, right? So I must be optimistic. But I think what may come of this in our nation is people will look and they will realize that when people are uninsured, when people are at greater risk of getting a disease and spreading a disease, that is an existential threat, not just to our neighbors, but to us as well. And so, for instance, in Texas, we are one of the few states that made the unfortunate, frankly, dumb decision to not accept the Medicaid expansion money that would have covered hundreds of thousands of these uninsured folks who are now going to get sick, who are now trying to get those tests to. It's not their fault, but they've become a vector for themselves and for all of us because they have no health care. And so perhaps what will come of this is we'll realize that we truly are not an island and that it's not about your neighborhood and my neighborhood and her neighborhood and his neighborhood. It's about public health, and that requires all the public to have basic health care. I think what the faith community is doing in Dallas is remarkable. We're having more of a spirit of coming together and a spirit of accepting safer at home. Our houses of worship really are leading by example on that. We haven't seen a lot of angry protest or people saying, I'll show you, I'm going to do it anyway, or whatnot. Pastors, imams, rabbis, other faith leaders, I think they all, as a group, are accepting what I heard one faith leader say on a call that we had the other day. The first duty of a shepherd is to protect the flock. And I think the faith leaders, the three of you in particular, are doing an outstanding job, of that. And then when we look at what the flock needs, 70% of the people who are currently going to the North Texas Food Bank haven't been before.
Wow.
So they're experiencing hunger for the first time.
Wow.
And they're feeling shame. There should be no shame in being hungry. They're feeling that, and we're scrambling to get them food. We started a virtual food bank last week that's already, raised somewhere around $240,000. But we're also trying to change the rules at the federal government level, hopefully early this week, so that we can get our request filled from the feds to replenish North Texas Food Bank and other food banks. There's just a whole host of those needs that are happening in the faith community. And mental health. People are under such stress, right? We've seen a 6-fold increase in child abuse and family violence. And, so there's such a role. And the faith community is stepping into that role. And I think they're first responders, as I've said, just as our healthcare heroes and our law enforcement and fire agencies are. The faith community is part of the response to this. And very, proud to stand with them because they're doing a fantastic job.
Clay, you publish every week, even several times a week, you publish these zip code maps that give the data of number of infections in each of our zip codes throughout Dallas. It's interesting to me that early on, some of the highest concentration of infections were in the wealth corridor of North Dallas. But then over time, what we've seen is a shift toward almost exclusively the high rates are in those places where essential workers are coming from. Those folks who are still going to work to make our food and to clean our buildings and to do the kinds of things that we need to have done. And so once again, all of this is tracking along socioeconomic lines, right? Where the deepest effect is being had on the people who are most vulnerable. So part of our question, I think, is as faith leaders, we don't just want to call attention to how to be compassionate in the moment, but we also want to call attention to how to advocate for a different way of being in the future. When we get to the other side of this, have you and your colleagues had conversation about what we're going to learn and what we're going to do next in order to work toward preventing these kind of outcomes?
We had those conversations for years before this happened. Every waking minute that I have right now. Now I do spend a lot of time. Spend most of yesterday working with groups to talk about what do we do to turn the economy back on and get people back to work as we get on the bottom end of this curve. But my waking hours are spent focused on the task, the mission right in front of us, and hopefully we know what the answers are, guys. I mean, it's not like this is enlightened us as to what the answers are. Perhaps it's enlightened enough interest in the answers to push them through. But the answers to public health is for everybody to have coverage and for everybody to see a doctor. And when everybody needs a test for something, it's available. And right now we're fighting with two major, hands behind our back problems. One, Texas is dead last in testing. And two, Texas, North Texas, this 4-county area and the smaller counties surrounding it is the most uninsured metro area in the United States. And so as it hits Seattle, since they had Medicaid expansion and they have a different wealth curve than we do, you're talking about a place with low single-digit uninsureds. And because of the University of Washington, the way they stepped up and because they were early, and so all of the government's resources went there, they had a lot of testing and low uninsureds. By the time they got to us, we have minimal testing. I spend a good chunk of my day begging people for tests and cajoling people and sometimes threatening people to get us more tests. And, and then we have this tremendous uninsured rate that is, frankly, a vector for disease. It spreads there more. And they have poor outcomes. 1/4 of our, it's about, I think it's 1/3 today, but of our people that have been hospitalized have diabetes as one of their underlying conditions. The mortality rate for a heart condition, which you see more in the Black and brown community than you do in the Anglo and Hispanic community, the mortality rate for that, once they get it and are hospitalized, is 1 out of 10. So that's why you're seeing in America now, we're not peaked yet. But when you look at every place that has peaked, what you're seeing is that this country is 18% African American, but the hospitalizations in this country are 38 for COVID-19 are 38% African American. The numbers are also disparate. The number of hospitalization percentage is much higher than the Hispanic population percentage. So that's why we're working so hard to kind of flood neighborhoods that don't have insurance right now and get testing there.
So Nancy and Omar, we've been
Can I ask a
working.
follow-up question, George?
All right, go ahead.
So I hear what you're, the implication of what you're saying is that people of faith who want to improve the health of all their neighbors need to be pushing their elected officials to um, pass policies that will provide more health insurance. But I know that that community health needs assessment also addressed a lot of other issues that were very important in health outcomes, like one that would not necessarily occur to people, like transportation. And so I'm wondering, you know, are there other things that we should be advocating for as faith leaders in Dallas County that will make this kind of disaster or crisis more manageable in the future for people's, you know, health?
Sure. You can take that community health needs assessment as a roadmap to better public health. If there's better health for the poorest of and let me remind you guys, this is largely working poor. Before this disaster happened, we had a low 3% unemployment, so full employment. You never have 0% unemployment, and 4% is considered full employment under the Bureau of Labor Statistics model. So we were a quarter, 25% below full employment. We were more employed than full employment. And yet 20% of our folks did not have coverage. And so that is a really, really important piece, because that one piece cuts that number in half. We've got a lot of our neighbors who don't qualify for coverage. They don't have all their papers in order to be here, so they would not get coverage. They're not full citizens. But those that would, you know, could get that coverage. Those that make $14, $15 an hour. But then you look at those other things like transportation, like food deserts, you know, all the things that are in there, and it's a roadmap. So we can't all do everything, but we can all do something, right? And so when we look at what can we do to improve transportation and food, improve fresh food, all those things on the long end are important roles that faith communities and others can play. As we come out of this, it's not going to be that, you know, it's like the end of a movie where the bad guy, you know, Independence Day, they shoot down the alien starship and it's a brighter day, right? It's going to be, we're coming back out of this, and a lot of people have lost their jobs, and our economy is in a bad place, and we got to all work together to dig out of it. So I said today when tweeting about joining us, don't be overwhelmed by the middle. But even as we open our economy back up, we'll still be in the middle, because the end is when we can get back to full employment. And really, shouldn't the end be that we get to a brighter future where the people that were left behind, even when we were 1% higher than full employment, who are working, who are cleaning your house, fixing your food, you know, cleaning your building, mowing your grass, building your homes, shouldn't it be that as we move forward, that they have quality health care? Not just, and I know the people on this call share my belief, not just because it's right. It should be a basic human right in the 21st century, that we have, you know, a baseline of health care for people, but also because it affects you. It affects you in your insured home, where you're making money. It doesn't matter if you're as we now know from looking at coronavirus, and these threats will, you know, continue to come at us. It doesn't matter how much money you have or how good your insurance is. If it spreads through your community, it makes a difference on the outcome, but it doesn't make a difference on whether you get it. So even those who are just thinking purely self-interest, hopefully coming out of this will think, you know what? Public health dictates. Public health is my health. My health dictates, and I deal with this problem so I don't have vectors all around me to get me and my family sick.
Well, what you've described is something that I think as faith leaders, we are always trying to make the point of, and that is that this is not about just individuals who deserve or don't deserve something. It's about communities that are knit together in ways that are inescapable. And so what happens to one happens to another. And so I hope on the other side of this debate, it will not just be about the worthy or the unworthy. On this day of Easter, there is a sense of surprising grace and hope that comes to all of us. And so we thank you, Clay, for all that you're doing in our community to keep us safe. We know that sometimes that requires a lot of personal sacrifice on your part, sometimes a thick skin. Sometimes it requires overcoming some differences even among colleagues, but we thank you for the grace that you're demonstrating and the way that you're leading us. It really is something we're proud of in our community.
Well, I thank all of you and everyone out there. And the last thing I would say is, just as our forefathers came through the flu in 1918, there was a worldwide pandemic like this. Just as our forefathers rebuilt, and when I should say forebearers, because it was our foremothers too, right? But just as they rebuilt their economy after World War II, and just as we as human beings have gone through this in the past, we will get through this together now. And I think it's probably one thing that two things that strike me on this all day. One is, when we think about Passover, it is actually a picture of families sheltered in their home as an angel bringing death goes throughout the land, visiting upon those who are not protected. Terrible toll. And so I think just as Israel overcame a very difficult, uncertain situation to make it to the promised land, we're going to make it. And just as on Friday for Christians, we celebrate Good Friday. Nothing really good that day when it actually happened, but the uncertainty, the despair, the hopelessness was there on that day of torture and death. But then Sunday came, and our Sunday is coming. So we cannot get overwhelmed in the middle. We have to focus on what's in front of us, but we have to have faith in the end, because the end will get here, and the end will be better than where we were before it started.
Well, clearly you don't have to be ordained to preach, because I think we just heard it from Dallas County Judge Clay Jenkins. Clay, Dr. Fauci has suggested that maybe we not be shaking hands in the future. It reminds me as we close about going in to see Louise Troh and her boys. And when we would keep our social distance from them during that time, we came up with a virtual hug, just crossing our arms and patting on the shoulders and hugging one another in this way. So hugs to all of you, and thank you so much for all the work you do. We'll be praying for you, and we're grateful for you.
God bless you.
Okay. Thanks everyone for tuning in to State of Our Faith. This is Faith Commons. We'll be back to see you again next Sunday at 12:12. Nancy Kasten, Omar Suleiman, and I thank you, and may you have a rich blessing during this holy season, Passover, Easter, and this Thursday coming up, Ramadan begins for our Muslim brothers and sisters. God bless you. All right, we're out. Thank you so much.
Thank you.
Hey, thank you all. God bless you.